market footy shorts like that too.
Oh, of course.
Cowboys colours. But
We're
all right.
good to go live?
Let us know when you're good to go. David Crisafulli with Ros Bates, testing 1, 2, 3.
All good?
Yeah, all good. Who tipped the Storm last night? I did. Did you?
No.
Oh.
Well, the Titans good.
The Titans for Sunday.
All right. Let us know when you're good to go. Well, in a moment, Ros and I will make some observation about some latest health data relating to here. But before we do, I just wanted to announce today that on Monday, the LNP will be hosting our 29th Town Hall Crisis meeting. And at the request of local member John Krause, it will be held in Bow Desert. And the Bow Desert community is one that deserves to have a say, as they have across Queensland, and as we will continue to do. And it's almost 9 years to the day since the LNP restored maternity services to that hospital. And at a time when Queenslanders are questioning the government's priorities around maternity in regional areas, it'll be nice to join that community and listen to them about the future of that hospital. Right, now to here. Yesterday, Ros and I had the great opportunity to tour the Townsville Hospital, and I want to sincerely thank the staff for their time, also senior leadership and the board, particularly the board chair who gave his time to take us around. They are doing a mighty job holding the health system together during what has been 8 years of decline because of government that has poor priority and poor planning for this region. And the latest figures don't lie. The latest figures show a deterioration in the number of people in North Queensland waiting to get on the list for elective surgery. It's effectively the waiting list for the waiting list. And there are 17,818 people on that waiting list for the waiting list. That's an increase of 24% in the last quarter. That is the biggest rise in the state. Do not blame a single staff member for that increase. That is the responsibility of the state government. That is the responsibility of a government that has not planned and delivered and then evaluated services in regional areas. And the local community, the local workers, the board have solutions that they could put on the table. But the greatest thing the state government could do is to remove the Brisbane knows best mentality and allow local doctors and nurses to be put in charge to drive the change that is needed. And when you see nearly 18,000 people just waiting to get on the waiting list, you know that the situation has reached critical points here in the north. So we'll continue to advocate for our solutions for the government to listen, as we have conducted the town hall meetings across the state. Better resources, better triaging, sharing data in real time, but above all, putting doctors and nurses back in charge at the coalface. And nowhere is that more important than in North Queensland, where there has been the biggest blowout in those waiting to get on the waiting list for elective surgery in the state. I'll ask Ros to say some words.
Thanks, David. Ros Bates, Shadow Minister for Health and Ambulance Services and registered nurse.
Might just fix the mic there.
Sorry.
There we go.
I'll do again. Ros Bates, Shadow Minister for Health and Ambulance Services and registered nurse. Well, Queensland Health was in trouble long before COVID, and these long waits to see specialists were in trouble long before COVID. Queenslanders deserve a world-class health system no matter where they live, particularly in the regions. To see that almost 18,000 people are waiting to actually see a specialist to have any sort of surgery is just not good enough. These aren't numbers on a spreadsheet. This could be your dad having trouble with his heart, waiting to see a heart doctor. It could be your wife who needs to have a breast biopsy and needs to see a cancer doctor. It could be your child suffering with tonsillitis and hasn't been yet able to see a paediatrician so that they can have their tonsils out. This government has had 8 years to fix the problem. It is now asking for another 7 years before many of these beds come online, so patients actually have beds to go to after they're operated. And it is just not enough that people are waiting like they are. Those long waits need to be looked at. Some of those patients may well have died on that waiting list to see a specialist. So we need to make sure that the people who are the most serious cases can actually get to see a specialist in a timely fashion. Yesterday, as David said, I toured Townsville Hospital and the Mater Hospital and the ambulance station, so I had good conversations with all of my hard-working frontline colleagues, and they want to see changes as well. The private system is more than happy to work with the public system. They just need to be unshackled from Brisbane to enable enable people to do that. And in a sign of the times, Hollywood Anna is on the red carpet with Harry Styles instead of looking after our hospitals, which are on red alert, and things can't stay as they are. Thanks.
Well done, Rosie.
A question on the wait lists more
Thanks.
specifically.
Thanks very much. And then I've got a couple of things on law and order if you want, but I'll wait for you, Lawrence, if that works for you.
Just with the wait lists
Yeah.
first, with the actual cause of it, how do you think the doctors and nurses in Townsville specifically are being hamstrung to not put in solutions?
By not allowing them to take charge the way that they should be able to. And if you're going to have health boards, they need to be able to make decisions at the coalface. And I will back a doctor and nurse working at the coalface in Townsville over the minister sitting in Brisbane every day of the week. And at the moment, they're being shackled by a system that has a Brisbane knows best mentality. And the greatest gift we can do is provide more resources at the coalface, but it's also to put them back in charge. And when you look at the funding for Queensland Health, increasingly less money is going to the health and hospital networks. Every year they are having to beg, borrow and steal just to keep what they have got. And yet the continuation of this Brisbane knows best mentality thrives throughout the minister and her department at a senior level. And we want to see local people making decisions for locals every day of the week.
The government's often said and referred to historically the LNP has cut a number of nurses and medical practitioners in hospitals. Is the LNP guaranteeing that they'll actually boost those numbers if they are elected next year?
We need more doctors, nurses, allied health professionals, and we need them now. And we need more beds. And the government is asking for another 7 years after 8 years of mismanagement. They want that period again before they start delivering new beds. And that can't continue. And we need more resources and we need more people at the front line. And the crisis in Queensland Health has been 8 years in the making. And ambulance ramping is the symptom of the sick system. But when the government came to office, ambulance ramping was at 15%. It's now at 41%. And Queenslanders are asking, when will it be back to a level that this state can rely on? When Anna Bligh described Queensland Health as a basket case, ambulance ramping was at 30%. That is a distant, happy memory. Things are so bad under this minister and the government. So I want them to focus on the future, because that's what we are. And we're focusing on the solutions that Queenslanders have told us as we have listened to them throughout the state.
A few questions on crime as well since
Yeah.
Monday. There's been 19 unlawful use of a motor vehicle offences in Townsville. That's an average of 4 cars stolen since Monday. What's your reaction to that?
Those figures are alarming, and the region is in chaos with law and order because in Brisbane the state government is in chaos. And you only have to see the flip-flopping on the policy when it comes to youth crime to know that the government doesn't see this as a law and order issue. They see it as a way to just get through the politics of it. And the committee hearings have exposed how flimsy the government's plan is for youth crime and how it was written on the back of an envelope to deal with a political issue before the Premier jet set it overseas. So let's call it for what it is. And one by one, people have bravely stood up in the very short window they've been given. This could have been debated 6 weeks ago if the government had listened to our calls to recall Parliament. But one by one, people have told the tale of how much youth crime is ripping communities apart. And I want to mention about some of the contributions, but in particular your local mayor's contribution. And yesterday, Jenny Hill said that the nonsense of detention being a last resort has to go. and she is spot on. So here's our solutions as a starting point. Embed consequences for action, unshackle the judiciary and remove this nonsense of detention being a last resort, and get serious about gold standard early intervention. There's a starting point. But if you look at what is coming through the committee system, there are people who are rightly pointing out the government's failings on this from all sides of the spectrum. From victims of crime to people who work with our young, vulnerable kids at the coalface. But there is one thing in common. Everyone agrees that the government is losing control of law and order, and that they see this as a political issue to manage rather than a law and order issue. And I don't see this as something that is about politics. I see this about communities who are getting torn apart. People who love where they live but are afraid because of a generation of repeat hardcore young offenders who know that their rights outweigh the rights of the victim. And we are failing at both ends of the spectrum. We're failing the hardcore repeat offender who's carrying the knife, going inside a home, taunting police to chase them, and we're failing the young kids who are early on in their journey of crime. The kids who need help and need hope. We're failing both of them, and the government just views this as a political issue they've got to ride out, and Queenslanders don't see it that way.
So we heard yesterday state governments and the police are launching the operation, high visibility operation in our shopping centres and public spaces, with police being paid overtime, doing volunteer shifts to fill this new operation. I guess, what do you make of that?
Look, Hayden, Dale Last has made some comments, our Shadow Police Minister, but I'll make a couple of observations. My style is to never stand in the way of anything that can benefit a single Queenslander, even if it's the smallest of small steps forward. When I look at the statistics, they show that in real terms there are less police today than there were 2 years ago, and the laws have been watered down. Is it any wonder we're in the middle of a youth crime crisis? We've got fewer police, weaker laws, and the government's throwing their hands up in the air and trying to blame everyone else but themselves for a youth crime epidemic that is ripping the heart and soul out of communities. And it was this community that was the first to stand up in 2015 when those laws were watered down. It was this place. And Townsville residents told the state government it will end in tragedy. And the state government didn't listen to people in Townsville. And one by one, we have seen communities that have gone from beautiful, safe places to crime enclaves. And it has spread like wildfire. And there is nowhere where I go where someone doesn't raise with me an interaction with a broken youth justice system and what that means to them. In Cairns, I stood with a young woman who had her car stolen twice in less than a year, and she told me how her insurance premiums went from $80 to $118. In Mackay, when we were there the other night, spoke to people who won't allow their kids to walk at night where they used to go and get a slushie down the road. Gundawindi on the border, beautiful little community. We're having a crime forum north and south of Brisbane, the Gold Coast, Sunny Coast. The images on the Gold Coast of just absolute out of control law and order. West to the Isa. Look, it is at epidemic stage, and the only people who see this as a political issue that needs to be managed through the media is the state government. Queenslanders see it as a law and order issue where we have to ensure that there are consequences for actions, unshackle the judiciary and remove crazy provisions like detention as a last resort. And let's get serious about turning kids around early before they reach that stage.
Just a few questions for Ros, if that's all right.
Sure.
Thanks, Dave.
I'm here all week.
Just Ros, on this,
Literally.
what do you think about the ambulance ramping increasing again in Toowoomba?
Look, we've seen the Toowoomba Hospital under enormous pressure. We've seen the Premier and the Health Minister out there making grand announcements, turning sods with gold spades, and we know that the beds at Toowoomba were needed years ago. We know that the Bailey Henderson site won't come online till 2026. Those beds are needed now. The only reason ambulances ramp outside the front of a hospital is because there is no room at the inn. Now, this government told us during COVID, give us 2 years, we'll sort out all the problems, we'll sort out the waiting list, we'll sort out the beds, we'll sort out everything. Well, now we're seeing that post-COVID, it is just as bad as it was beforehand. So make no mistake, Queensland Health was in trouble long before COVID. Toowoomba has been a city that has been growing, who has required extra services, and only at the death knell of a tired Labor government are they making these announcements. It is all too little, too late.
And just also, there's been some disturbing vision of a baby in Bundaberg that was given a vape. Just on access to vapes across the state for children, do you think that access is too easily available for children at the moment?
Well, we know that a lot of illegal chop shops are selling vapes to teenagers, to adults. A lot of those actually have tobacco in them when they're not supposed to. It is Queensland Health's responsibility to come down hard on those illegal tobacco shops. These are not the signal shops where you buy your normal cigarettes. These are ones that are already flouting Queensland Health's laws by having the word cigarettes or tobacco on the front of their shops. They are illegal substances that are being sold, and it's Queensland Health job to come down hard and close those down. Of course it's dangerous for young children to be vaping. It's even more dangerous for babies to be inhaling God knows what out of a vape.
Have you seen the video?
No, I haven't seen the video. I saw the pictures online. But obviously we've seen issues like this with drug users using methamphetamine around their babies, and what those sorts of issues can happen to them. We need to protect our youngest and educate the parents that whatever they put into their bodies can also affect their newborns and even their babies in utero.
At the end of the day, these vape shops obviously sell products that can be a health issue for a lot of people. Do you think there needs to be a limit on how many of these shops can pop up in cities? We're seeing them pop up all around in the southeast especially.
Well, I think none of these shops should be able to sell illegal vapes, which they are, which contain tobacco. And again, that's a law and order issue, but it is also under the auspices of Queensland Health. I know that there are illegal chop shops in my electorate. In Mudgeeraba, there's about 6 on the Gold Coast, and Queensland Health has not gone in and closed them down. So if they're readily available, of course kids are going to go and get them, and they're cheap, and that's who they market them to. So it's not a solution to stop people from smoking. It's actually a pathway to smoking.
Just with staff shortages at the hospital,
Sure.
It's been said it's quite a big problem bringing doctors, medical specialists to the regions and keeping them here. What's your plan to fix that solution?
Well, I think we need to have packages to attract people here. I mean, Townsville's a beautiful place. It's not outback Queensland, it's a city. And we need to make sure that when we are recruiting doctors, we're remembering that they actually usually come with a partner, they come with a family, so it's jobs for the partner, it's schools for the kids, it's accommodation for them to come and stay. And I know that there is a problem with rentals here at the moment in Townsville. So Queensland Health, instead of spending thousands of dollars a day on locums, should actually look at more attractive packages to keep our specialists here. Once you get them here and you treat them well and the culture's good, then they'll stay.
Cool.
The 24% increase here in Townsville, but across the state was, if the LNP were elected tomorrow, next October, what would be the first action, I guess, you were to be health minister? What would you implement to help solve these?
The wait list? Well, I mean, the LNP in 2015 had a on-time surgery guarantee program that meant that if we couldn't do your surgery in the recommended time frame in a public hospital, we would partner with the private sector, which is happening by stealth under Surgery Connect now anyway. But that was the first thing that Cameron Dick axed when he came in as the health minister, so that was our solution to clean up those surgical wait lists. I've always said that the long patient wait lists need to be reviewed. Some patients have been on that list so long they've either died, they've gone and paid to go private, they've ended up probably needing to see a physiotherapist instead of an orthopaedic surgeon. So it's actually sitting down and re-looking at those lists and prioritising who needs to see a specialist right now.
Thanks, everyone.
Thanks.
Thank you
Have a great day.
Thank you, everyone.
Yeah,
We got to head, yeah.